Now, in Kenya's massive Dadaab refugee camp, hundreds of thousands of displaced Somalis are facing multiple health problems, which doctors say are compounded by overcrowding. Joining us now on the phone is Dr. Mohammed Gedi, director of the MSF General Hospital at Dagahaley Refugee Camp near Dadaab. Dr. Gedi, welcome to In Focus.
Thank you very much.
Yes, now, since we spoke last time, it's been several weeks. How can you describe conditions in the camps there?
The conditions, we've had more and more measles cases in the camp. 2 weeks ago, it was entirely in among the new arrivals from Somalia. But last week, it spread to the rest of the camp, and we're seeing more and more old patients coming with measles, and majority of them are adults. We had more than 100 cases of measles last week alone.
Now, how are you controlling this? Do you have all that you need in order to deal with these cases and with the numbers of those existing refugees and those who are coming in?
We have initially been, the last 3 weeks, we have been immunizing all people who are less than 30 years of age coming from Somalia with the measles vaccine. But from next week, we are starting a program where the whole camp, whether new refugees or all refugees, will be immunized as long as they are less than 30 years of age.
Now,
it will take a whole week of vaccinations in the camp.
Yes, it sounds like you have whatever you need to deal with those cases. You have all the medication that you need to do the immunization and to treat all the patients that are there?
Yes, with the vaccine supply, it's a little bit complicated, and it goes through rigorous procedures. But now we have all the vaccines in the country, and on 12th of September, we are starting the mass immunization of all these refugees.
Dr. Gedi, several weeks ago, refugees came in, you treated them. Tell me how you have observed their progress. Those who have been affected severely by malnutrition and so those other illnesses, tell me how they're doing now, those who came in several weeks ago.
We had two big problems. Initially, one was patients who are already malnourished coming to the camp. Then we had another group that will come normally, but because of the long process that they have to wait for them to be registered as refugees, they are becoming malnourished in the camp. Now that has changed because with the UNHCR system, it's taking much shorter time for them from the time they come into the country, the time they are registered, and the time they're getting a food ration. It was taking at one point more than 42 days to go through this process, but now within a week they are able to access their food supplies. So in the next few weeks we're expecting better outcomes in terms of the nutrition state of the new arrivals. Also, the number is slowly decreasing. It's from 2,000 per day, and now less than 1,000 per day. So in the coming few weeks, again, with more aid going into Somalia, we expect the numbers to reduce a little bit.
So in just about 15 seconds, would you say the conditions seem to be improving and the future looks better than where you've come from?
At the moment, there's a lot of many organizations doing their best in terms of supplies, in terms of personnel, and even the coordination between the agencies that are taking place because of the famine situation in Somalia and the crisis that we're having in Dadaab. As long as we have this teamwork, coordination with many agencies coming and more resources coming in here, we expect a better outcome. But if things, once the numbers go down, everyone will go back. It will be really, really hard to maintain whatever we're doing now in terms of the progress.
Thank you. Thank you very much, Dr. Gedi. That's Dr. Mohammed Gedi, Director of the MSF General Hospital at Dagahaley Refugee Camp near Dadaab. I want to thank him very much for joining us today on In Focus.